Last week, we talked with our good friend, Dr. MarkAlain Dery in New Orleans about what's going on down there and what he is observing. Now, a lot of people wanted to hear more from Dr. Dery because in the week that's transpired, we've learned more about New Orleans as a potential intense hot zone for this illness, this new pandemic, and people wanted to know how Dr. Dery was doing as well. So I'm sure we'll have a lot to talk about, both in terms of New Orleans and Louisiana and the country. So without any further ado, Dr. MarkAlain Dery, thank you for coming back.
Thank you so much for having me. It's such a pleasure.
It's always a pleasure to talk to you, although needless to say, I wish it were under better circumstances. So let's start with this. Since you and I talked last week, there's been talk about just the skyrocketing, it seems to me, rate of infection in New Orleans, potentially, I suppose, therefore, elsewhere in Louisiana. I've heard that maybe the governor of Texas doesn't want people coming in from New Orleans. I spoke to a friend today who got out and went to see his parents in Florida, but now he's quarantining for 2 weeks from his parents. And there's a lot of talk about the way in which it might have been transmitted too. So again, I'll start with this. How are you holding up?
I'm doing well. Thank you so much for asking. I've been, it's been very, very busy. The last, 17 or 18 days have been a lot of running around. I've seen more patients than I ever have in my life in such a short period of time. Telemedicine has been an amazing tool that we've been using. So thank goodness for that. And sometimes I just resort to just using FaceTime on my phone, WhatsApp, the telephone for that matter. And so I've been able to care for quite a large number. I think I guesstimated I've probably in the last 2 weeks probably laid my hands on, talked with, evaluated and or tested probably over 1,000 people, just specifically for the coronavirus, which I just shorthandedly refer to as C19. So if I say C19, I'm just referring to that as COVID-19. So it's been pretty intense. Yesterday I hit a wall. I did a couple hours of interviews and lectures, and then I just completely collapsed and slept and woke up this morning and felt kind of refreshed and good to go. As you know, my wife is a deputy chief of staff for the mayor of New Orleans, and so she has been running some very intense hours. So the Dery/Elliott household has been very busy and really kind of addressing what's happening. I think that to a large degree, it's every day is a new day. It's something different, and quite frankly, incredibly unexpected and quite frankly shocking. And I know we'll get to that in a moment as a carryover from last week's conversation. But otherwise, well, thank you so much for asking, RJ. I appreciate it.
Well, it means a lot to us, the health of both of you, and of course, what the implications for the service you're both providing to the city and to the population there. So, and let's pivot now. When you and I talked last week, I have to confess, and by the way, I will apologize in advance if I'm sipping tea, but I'm on more steroids than Arnold Schwarzenegger at his peak in order to keep going. So I it's a sort of broadcaster's trick. But when we talked last week, I have to say, as aware as I was of the gravity of the problem there, if anything, in the ensuing week, it seems as if New Orleans is at this point in a state of grave crisis. And either I didn't realize it was trending that way or something happened, but maybe you can let us know what's going on there now.
Well, so let's start with some numbers, if you don't mind. I think that the numbers really tell the story. I think it was the New York Times, I think yesterday, something that we had been hearing whispers about, and that is that right now New Orleans has the highest incidence of new cases. And just to kind of remind our listeners about what an incidence is, there's two ways of measuring disease. One is you just go out and just count the number of people that have a particular disease. We refer to that as prevalence. So of course, states or cities that are large have larger number of cases because there's just more people there.
Right.
That's referred to as prevalence. But when we talk about incidents, and in the several times that I've been on the 0 Hour, we've talked about how, like, for example, New Orleans has the highest incidence of HIV, right? And we've talked about that, and the same thing with hepatitis C. But incidence is looking at specifically the number of new diagnoses. So when you have a high incidence of a disease process, so here let's refer to it as like COVID virus or C19, the high incidence means that we have these new diagnoses that are turning up every day, and what that implies is that there's an ongoing process, ongoing infection, that we don't have the infection in check, or the epidemic rather in check. So just to give you a couple of numbers, so as we know Washington State has been affected, and when you look at their incidence rate is 34.2 per 100,000. When you look at New York State, which we now know is quote unquote the epicenter of the epidemic, it's 157 per 100,000. When you look at New Orleans, it's 255 per 100,000. So we are roughly, if I could do the math quickly in my head, maybe 7 times Washington State, the incidence, and maybe a time in about 1.5 more than New York New York State. And what this just reflects is that right now, with the highest incidence in the world, so we have these high numbers, again, reflecting new cases.
And you know what? I think this is so important. I'm so glad you have these numbers, MarkAlain. Is, for example, myself, I've been writing a lot about the epidemic, as a lot of writers have been. But I found that even what I considered a rudimentary piece of data was not available, despite the massive coverage. And it's precisely what you're telling us, because to me, what matters most, for example, to an individual reader, or I hate to use the word consumer, but somebody listening to this program, or whomever it might be, that one of the critical pieces of information about where you live as an individual, or people you care about, or the society you care about, is population based. It's per capita. So number one, if New York has X number of cases, but there are a lot more people in New York than in New Orleans, and New Orleans has X plus 50%, New Orleans is probably a lot sicker, right? And yet, with all these illustrated maps that the New York Times and everyone, where you move your finger and it does pretty things, nothing on a per capita basis like what you just described, nothing on a trend line basis when you talk about new incidents as opposed to prevalence. I mean, if one person out of 100 has this, but it's been that way for 3 weeks, that's pretty different than if only 1 in 1,000 had it, and now it's up in 3 days to 1 in 100, right? So we're not looking at trend lines, we're not looking at population baselines, and I feel, slight diversion, but you are also the founder of WHIV Radio in New Orleans. I feel as if our news media are not ill-serving, but underserving the public in terms of what they need to know about the clinical nature of this pandemic.
Yeah, I, of course, 100% agree with you on that. And in fact, I have read a couple of articles that were something along the lines of, hey, New Orleans has the highest incidence, how come people aren't talking about it? And then, of course, the next day, the New York Times did actually put something out there kind of confirming that. But when I did find the New York City, I just want to give you one last number. New York City has about 22,000 cases in total, as opposed to Louisiana, which has 2,300 cases. But when you look at the incidence, again, this is a rate. When you look at it, New York City has 253 per 100,000 versus New Orleans, which again has 255 per 100,000. So we are a much smaller city. We have a much smaller number of cases, so the prevalence is a lot smaller. But the fact that there's this ongoing rate, that it implies that the epidemic has not at all been contained. And quite frankly, it's, as I was reporting out to my clinic system that I work in here in the state of Louisiana, we are the largest Medicaid providers here in the state of Louisiana. And as I was talking to the CEO and the CMO and the COO and those guys, the C-suites, I was very clear to them that we are about 10 days behind what is going to probably be what to me is going to be a tsunami of cases. And I think that New York City is probably a couple days behind. And I think that that's going to happen probably very soon. We're starting to see a lot of talk about that. The Governor Cuomo has been, very aggressively on TV, kind of indicating that the need for ventilators, the need for more hospital beds, ICU beds, is pretty drastic. I think that they were asking for, something like 40,000 new ventilators, and so I think that we are woefully unprepared. I think that moving forward, while I think that what we're seeing in terms of the different states are, and it's mostly blue states. I don't want to try to politicize this, but it is pretty profound that you're seeing governors that are in red states that are just still allowing businesses and schools to remain open, whereas you're seeing other states, and particularly what's happening in California and what's happening in New York State. I find that the Governor Newsom, and when he gets up and talks, the people who are advising him, especially the physicians or public health practitioners, are doing a very good job, and he's really echoing, I think, information that's very appropriate. And I think the same thing with Governor Governor Cuomo as well. Our governor here, John Bel Edwards, I think maybe was probably just a clip or two behind the eight ball, if you will. But I think that he's starting to recognize very quickly how serious and how grave the situation is. And he's actually just straight up talking in public health terms. He's not downplaying it. Now the people who are advising Governor Edwards, I think, are doing an excellent job, because he's really embodied this whole idea of things like flattening the curve, or, incidents, things that otherwise people, especially political leaders, don't usually talk about. He's been doing a good job. But just let me be very clear here, even though a lot of us are practicing social isolation, of course, you aren't in the We Act Radio studios, and of course we're working from home. I still think that we are going to see it's going to get worse before it gets better.
Well, and I wanted to come back to that, because frankly, it's a little bit frightening. What I was thinking of while you were describing that was, if you know the term jump scare in television and movies, where the idea is the protagonist walks like into a dark hall or something, and they think there's a ghost or a monster or killer or whatever, and they open the closet doors and everything's fine, and they in the audience breathe a sigh of relief, and then they turn and the killer appears with the dagger, just when you think maybe it's going to be okay, right? And that is my understanding of a jump scare. And I'm wondering whether what you're saying here, and again, we're recording on Thursday, is that we may be facing in both New York and New Orleans a jump scare in the next few days.
Yeah, there's no question about it. I think that there's no question that the city here is planning on moving forward and anticipating medical shortages, and are planning appropriately. And really thinking out of the box. And I am hopeful that is happening around the country as well, because the real issue here that is incredibly problematic, and I think that I have shared with you this kind of in a personal time, but I think I'm happy to now talk about it kind of openly, although it's not something I talk about very often. And that is when I responded to the Haiti earthquake in 2010. I was there, 3 days after the earthquake, and we had no supplies. I ultimately helped construct what became the American hospital there, but we were practicing out of tents initially, and out of the hangar outside of the airport. And we had to make decisions that no physician, no human being should have to want to make. And those are decisions that are just, quite frankly, as a result of just a complete lack of resources. And, in particular, what I was seeing was people who had tetanus, and elderly people with tetanus, and who also that were co-infected with HIV, but they had advanced HIV, which we refer to as AIDS. And I could not get any hospitals, any of the American hospitals. We were moving people onto the naval ships, and then they were being transported to the hospitals on the coast. And so very difficult decisions were being made. And I think that the Italians are warning us right now that you are going to be making difficult decisions. And I think in this country that has never had to deal with scarcity before in the past, things have always been in abundance for us. Now, whether or not that's good or bad, that's a different conversation. And I know our personal conversations have circled around that idea. But I think moving forward, I think we are going to have to make decisions that physicians have never had to make before in the past, and that are going to be very painful. And what I'm speaking out particularly are the distribution of ventilators, the distribution of ICU beds. What we're seeing in different parts of the world that this is affecting, particularly the Italian experience, what we're seeing is that ventilators are not being used for people over the age of 80, for example. And these are the sorts of decisions that we're going to have to be making here. Because the thing with these ventilators, especially when we're talking about people who are a little bit more advanced in age, not only do they have more comorbidities, other illnesses, but the other thing is that once you put somebody on a ventilator, oftentimes it's very difficult to take them off of that ventilator, as opposed to putting somebody else who may be younger, a little bit more healthier, where you would put them on a ventilator for a couple days and then, and then be able to wean them off that ventilator, and then ultimately use that ventilator for other things. And another thing that
I just wanted to jump in and say, Dr. MarkAlain Dery, that as you know, because we're friends, it is not only a conversation I consider politically and socially important, it's one I take very personally, because I'm multiply at risk, because if I found myself in a situation where someone with better prospects deserved that last ventilator more than me, I would give it up gladly for their sake, but I would have to confess to you with a certain amount of unrestrained anger in my dying breath. And I know what it means not to be able to get a breath, by the way. It is an extraordinarily unpleasant experience. I would like to think I would go thinking charitable thoughts, but I'm not so sure. So what we're really talking about, and I'm certainly not 80, but I mean, I got multiple risk factors. And I guess, but what bothers me the most about all of this is the lack of planning, the lack of thought, the lack of care. And now in the face of this crisis, well, if you got them, you got them. If you don't, you don't. You doctors figure it out. So it's not only brutal to people with vulnerabilities, it's horrific to physicians and other medical caregivers like yourself, in my view.
Yeah, I absolutely. One is I do want to just acknowledge that, yes, I too am worried about you, and it's those individuals like yourselves, RJ, and I of course don't mean to scare you, but people with chronic respiratory issues are some of the highest risk individuals, as well as those people that are a bit more advanced in age as well. And so it is of great concern. And I think that, if you don't mind, if we can kind of get into something that I know that we had talked about just a little bit earlier, and that is, you're 100% correct. When last week, when you had asked me if I had expected something like this to be in my backyard, quite literally, I had answered the question and then promptly contradicted myself in mid-sentence, and was somewhat frustrated myself as I was talking, because I realized I didn't actually really have a good answer. I answered in a very academic, erudite sort of way, which is, well, I'm an infectious disease doctor. Of course, we were expecting a big pandemic. But I think that what I didn't expect, as somebody who is a very voracious consumer of current events and of news, and especially of political news, and especially one that really cares about Medicare for all, caring for people. As I had indicated to you, I'm a Medicaid doctor. I work in clinics that only service the uninsured, underinsured, poorly insured, and Medicaid insured individuals. I too am completely shocked at the lack of preparedness. Now, if you'd asked me that, I would say, well, of course we are. But it wasn't until this weekend where I was I served as the medical director for some of the testing sites. So what happened was that over last week, the President Trump had committed to a pilot program of 3 testing sites around the country, and New Orleans was one of those pilot testing sites, one of these drive-through testing sites. And I was tapped to be the medical director for that testing site here in New Orleans. And while I'm very proud that we tested 450 people over the weekend, I want to be very clear that over that same weekend, South Korea tested 60,000 people. So just to give you an idea of the difference of testing, and we can talk about testing in a second because I do have some testing statistics as well. But over the weekend, my picture was taken and where I was wearing full PPE, and it was a very dramatic picture, and it made it into the Sunday paper. And as a result of that, the social media folks at WHIV posted it on the various WHIV social media channels, and I started to hear back from my colleagues from when I responded to the Ebola epidemic in Sierra Leone, in Freetown, Sierra Leone, with the World Health Organization. And my colleagues were writing me and private, direct messaging me, as well as my previous boss with the WHO. And they were stunned, and they said, I can't believe this is happening. Your PPE looks exactly like what it was when we were fighting Ebola. And when I sat and I could see the picture, and I could see my friends and colleagues' comments to me, and then hearing your question in my mind's ear, I was really struck, and I too was very frustrated, because that is the time that it really hit me, where I recognized that what we have done, and again, I knew this intellectually, but it became deeply emotional for me, that we have cut public health services to the core. We have gutted it to the core, and what this this pandemic has shown us is that we are woefully unprepared. We don't have any planning whatsoever. The supplies that we need to keep us safe, the PPEs, the personal protection equipment, the masks, the gowns, the gloves, the face shields, these are produced in China, which has recently been on lockdown. And so when a country is on lockdown and we don't stockpile these supplies, we are the ones that are at risk. And I'm sure you have seen the stories of healthcare workers, myself included, who have to reuse our PPEs. Right. And again, as I said earlier, we're used to having things in abundance. And this is the first time that we do not have things that are in abundance. And largely because, again, some of the masks also too are made in Italy. So who are the 2 countries that have completely shut down recently as a result of the C-19 virus? And that, again, has been China and has been Italy. So downstream, we just don't have the supplies that are necessary. We don't have the stockpile that is necessary. We don't have the infrastructure that is necessary. And when we think the place that we're at right now is 100% because of a lack of testing. And I have some testing statistics I want to share with you. South Korea.
Let me just jump in for a second and say, I do want to hear the testing statistics, but just a quick comment, Dr. MarkAlain Dery, which is, again, I mean, there is the structural and the issues we must confront on a pragmatic basis now, and there is also the emotional, as you were talking about, the same outfitting that you had in Africa. I was thinking about my reaction to 9/11. I had a pass to World Trade Center 2. I worked in that area at the time for a long time. When I went down and saw the ruins very early on and saw the soldiers going back and forth, things I had seen in war zones, things I had never expected to see in what was then my hometown of New York City. And so I think there's probably a dimension of that in your reaction. And in terms of the unpreparedness, I have to agree. I think we I saw it in my medical care for the last 2 weeks. The lack of, I experienced medical scarcity for quite some time in certain ways, and you're experiencing it in terms of frontline defense that allows you to continue to care for people as well as protect yourself. And so here we are. And in terms of totally unprepared for that. Again, as I keep saying, entirely not inevitable, but predictable event that there might be a pandemic, that it might be even coming from China or some other place that's critical to our supply line, which we've extended to impossible lengths to maximize profit, on and on and on. So here we are, and we're short of testing. And what were you going to say about that?
I was going to just talk about the testing and that in South Korea, their testing rate is 4,100 per million people, compared to the U.S., which is 26 per million people. And so what we're seeing largely is, and I think I may have mentioned this on the broadcast last time, which was that there needs to be an investigative reporter, or I guarantee you somebody will go and understand that Germany had essentially created the test. Was it a perfect test? No. Its sensitivity was slightly off, which basically means that you can't trust necessarily negative test. You could definitively trust a positive test, but the negatives, there may be some false negatives. That's referred to as sensitivity. But they had scaled up the testing. The testing was available, and it was scaled. It went to the WHO, and the WHO distributed it immediately. Whereas in the U.S., actually...
And MarkAlain, just to interrupt for a second on the ratio of testing there, if I heard the numbers correctly, which I'm not sure I did, but basically doing the math in my head, for every 10,000 people per X number of population that they're testing in South Korea, we're testing 2 or 3.
That's right. Yeah. That's exactly right. That
ain't good.
No. And when you look at the South Korean experience, the countries that I've been pointing to for people to look at and to look to see who actually did this, who did very, very well, was South Korea, because South Korea immediately got on did very aggressive testing, anywhere between 10 to 20,000 people a day. The Wall Street Journal reported 20,000. I was using 10,000 maybe last week, but since then that number has been corrected to 20,000 tests a day. 20,000 tests a day. But again, they had an infrastructure here. Again, if I could just politicize for a second, what we are seeing is we see more, taxes being cut. You have Amazon that doesn't pay any taxes. You have something like GE where they make it so that the government has to pay taxes back to GE, for example. I'm not an economist, but I do read these stories. But I do recognize that when you have a government to run and you're not collecting those taxes, and I don't mean to simplify this, but I have a simple brain when it comes to the economy. Of course, things are going to be cut along the way, and because if you don't have a leadership at the top that believes in public health and recognizes that you need to invest in public health on a regular basis, otherwise you will be caught quite literally unprepared to the level that we're seeing here. And just to kind of just to wrap up that idea of testing. Somebody wanted to privatize the testing in the U.S. That's the bottom line there. And I would love to see, and I've been hearing, lots of rumors, and I certainly don't want to repeat them because I don't know if they're true or not, but certainly the interest in capital was far more of a motivating factor than there was of people. And then that leads me to the next point, especially in this past week. What we have seen has been just a complete grotesque example of capitalism that has been run amok. The idea that we are putting capital ahead of people. It's capital and profits ahead of the health of people. I mean, you had the lieutenant governor of Texas who just kind of came out and just said it. Again, he said the silent parts out loud when he said, listen, if old people should, consider, and he used himself as an example. Listen, if I have to lay down and die so that we can continue the tradition of our country to remain and keep the economic engine of the country running, again, the one thing, again, this virus has definitely shown that the people who make decisions, the establishment, the political leaders in our country, at least those that are here now, really are prioritizing capital over prioritizing the health of people, and it's really quite shocking.
Well, I wrote an entire essay from the point of view of the one being prioritized against, and so I won't summarize it here. It's called "I Won't Die for Your Damn Economy." But if I have anything to say about it, which I may not, but I will say that it was an odd sensation, MarkAlain, to see the stock market surge on the announcement that the government might prioritize the lives of people like me, or rather the deaths of people like me, more highly than they would any potential harder hit to the economy. And the S&P 500 goes great. We love it. So that's the world we live in. Before we go, because you know how much I love New Orleans and care for the city and always have, it turns out that there may be a sad lesson there, right? And I'll tell you, it's from an analytical point of view, I have mixed feelings about it, which is there's some talk that maybe Mardi Gras was a major source of transmission for this, because not only is it a big public gathering, but it's a big public gathering where people get like really close, like too close for me because I get kind of claustrophobic, but they get super close and breathe on each other and touch one another. But it's a wonderful, New Orleans celebration and tradition. And you sent an article about how parade in Philadelphia may have, spread the 1918 influenza virus and so on. But is this, obviously nobody's going to hold a parade now, but I guess a two-part question is, what are people saying now about Mardi Gras' role in this? And could the silver lining, if you call it that, mean that maybe the rate of transmission will slow once all those cases have appeared?
Yeah. So, I think last week I was kind of speculating because I was really stunned as I was seeing the doubling of cases so quickly. And, as a public health practitioner and as a trained statistician / epidemiologist, it was hard not to just to take a step back and say, well, what's so different about New Orleans? And Liana, my wife, also, and as we've been kind of talking with one another, Liana also made an excellent, devastatingly excellent point in which she said, what other country celebrates Carnival? And I was like, Italy? And she's like, right.
Wow.
And I was like,
well,
right?
Italy's also the second oldest population, so
right.
That's a toxic combination. Yeah,
absolutely. So when I sent you that article, just to kind of indicate that as public health practitioners and as somebody who's a student of infectious diseases history, we're all aware that parade that happened in Philadelphia, just very, very quickly, with very, very quick history lesson, World War I ended because they just basically ran out of soldiers. The soldiers had died of influenza. So the remaining soldiers, those that were still alive, had actually just packed up and they had come to Philadelphia, and the organizers really wanted to celebrate American patriotism, if you will, in the sort of victory, if you will, of World War I. Public health practitioners were like, please don't do this. This is going to be an epic disaster. And the lesson there was that it has been seen, and history looks back at that parade as being certainly an accelerator of influenza, because almost within a couple days, if not a week after that, you started to see rapid doubling of cases, as you would expect when you put lots of people together. Here in New Orleans, we have a wonderful tradition of Mardi Gras. If you've never been to Mardi Gras, it's not what you see on TV. It's actually a children's holiday, people dressed up in costumes. And the thing that again, something that Liana pointed out to me, was there's the tradition of throwing things from the float to people. And those things act as perfect fomites. So let me just very quickly define what a fomite is, but I'm going to use a really ugly example of American history. So forgive me for having to look back to our beginnings, in which the forefathers of the United States, in an effort to help to continue the genocide of the American Indians or First Nations peoples,
I know where you're going.
with smallpox on it.
Right.
Those
Right.
and they were taken off of people who had smallpox, and they were transferred over directly to Native American people. Those blankets act as fomites. So a lot of people don't realize that inanimate objects actually can carry infection. And the things that, like, so you have people that are on floats, sneezing, coughing together. Everybody, people are drinking. Their social distancing is not there. And then now they're throwing things to people, and you have that. And like you said, you have a large group of people where our social space is a lot smaller because everybody crowds together. And then the most devastating thing of all, RJ, is that Philadelphia had one parade. We had 70 parades, just to give you an idea of that devastation. And then lastly, when you look at the age distribution of people who are getting C19 here in New Orleans, you have a far more equitable distribution across age brackets, as opposed to the shifting of the ages toward those that are elderly or those that are more advanced in age. And my hypothesis there is that also has to do with Mardi Gras, because you had many, many more people that were clustered together. And I think that that's what describes that age distribution. So I do think that Mardi Gras had to do with this. Now, of course, we didn't know this. In no way is this an indictment on the city of New Orleans or anything along those lines. No. It just was. It just was a thing that happened, and I think that that history and historians and epidemiologists are going to look back, and when they go to understand what happened here in the New Orleans experience, I think that people are going to point to Mardi Gras as being a major viral accelerator of the novel coronavirus.
Yeah, it's sad, but as you say, unpredictable. And by the way, I jumped immediately to the same conclusion as you were talking about the same age distribution. And what I infer from that, and then I'll give you a brief last word, but what I take away from that is that it's a tragic and unforeseeable consequence of a beautiful knitting together of community among generations and walks of life and so on. It just so happened that by a tragedy of timing and medical science, that it may have had a very harmful outcome this time. But hopefully, and this will be my concluding thought, and I'll give you one, hopefully in the months and years to come, we will learn new ways to express that community, not just in New Orleans, but everywhere.
Yeah, I 100% agree. And just to follow up on that thought, then I will say one last word, is that viruses exploit human behavior. HIV exploits the behavior of sexual interaction between humans, or the sharing of needles. Hepatitis C, the same way, the sharing of needles for IV drugs. Influenza, coughing, sneezing, and then breathing in that air. There's no question that the coronavirus here was able to exploit the human behavior of community, like you said, because Mardi Gras is really a cherished holiday. Again, it's not what you see on TV. It's not the debauchery. It's not all the grotesque things that you see on TV. If you've never been to a Mardi Gras, you don't understand. It is really a beautiful holiday. It's a children's holiday here in New Orleans, and it is a beautiful one. And I think that virus was able to exploit that our behavior. So, but just as a final thought, RJ, and I think I may have said this last week, but I think it bears repeating, and I say this every time I appear on any media outlet at all, is that there's 4 groups of people that we really need to be very thoughtful and mindful for moving forward, because they are going to, and please, as you know, I'm an atheist, but I do believe in the power of positive thinking and positive thoughts. The people in nursing homes, we have had devastating results, 2 clusters and 2 different nursing homes, and a lot of deaths. So people in nursing homes, people that are in the carceral system, are greatly vulnerable to this virus. Yeah. People that are in ICE detention centers or in immigration centers, these people who are quite literally locked up in cages, and those people who are homeless. And those people who are in homeless shelters are very, very vulnerable. And so if there's anything that folks can do to keep them in their thoughts, or actually do something for that, Everybody should wash their hands. Please stay indoors. Please treat your cough. Don't let a cough go untreated. You could use cough suppressants. And please reach out to people who are older or more vulnerable and make sure that they're doing well. Make sure that they have their medications.
I think that's all wonderful advice. And who knows, depending on what the world looks like next year, you may even see us at Mardi Gras. So, but in the
I hope so, RJ. You mikase tu casa.
Thank you. And likewise. And Dr. MarkAlain Dery, thank you for all your great frontline work in this struggle. Thank you for all your insights. And as always, thank you for coming on the program.
Thank you.